As I said, I wanted to start with, where it all began. I'm sure all of you know that the Horse Racing Integrity and Safety Act was passed at the end of 2020, and Congress essentially required us to do a whole lot in a pretty short period of time. So in 2021, this is what HISA was. It was John Roach at a desk with a laptop and a lot of papers. He was asked by Congress to help work with them to create a nominating committee. And the nominating committee was a group of very experienced and really important people who were going to make the selections on who would be on the HISA board and the various standing committees. So that was 2021. Then we had the sort of original four. In 2021, for all of 2021, it was just these four people working for HISA. Hank was the first interim CEO, and Steve Keach, who's our head of technology, was given a blank piece of paper and asked to create a portal where we could take on the registrations and the introduction of information and the cataloging and the data analysis. And that was only in 2021. It was only in 2022, when I started in February of 2022, we hired our last director, Bethany Erb, at the start of this year. And these are the people who are now powering HISA, every day, and who I'm very grateful to. I've got the best team imaginable. So getting now to sort of where we've come. As I said, back in July 1st, 2022, when we launched HISA and we had our very first registered person, we are now at 36,000 registered persons in the HISA portal. We've got 76,000 horses that are registered in the HISA portal. We've done at least 500,000 pre-race inspections across the country with our partners, and I have to say that everything that HISA has accomplished, the challenges, the successes, the setbacks, we've been really grateful to work with an incredibly dedicated industry. Whatever differences there are, I've never met anyone in horse racing that doesn't care about the horse, want horses to be safe, and care about the sport. There's differences in how we get there, but everybody starts with that proposition. And then we have, which is really exciting for us, at this point in time, 4 million veterinary treatment records in our system. And what that enables us to do, I'm going to talk a little bit about, but it gives us the tools to give back to the industry. When we started back in 2022 with the Racetrack Safety Program, many people said we were sort of trying to build the plane as we flew it, and that really was true. We had a mandate from Congress to launch immediately. We didn't have the luxury of waiting, although we would have loved to have more time to roll things out. But now we're in a position where we can finally start to see the benefits of all the work that the industry has put in and that we've built together. So what's been our primary mission? Obviously, keeping our athletes safe. That's both horses and riders. The metric that, standing here today, my team and I are most proud of, it's that in a year, we've managed to significantly reduce the equine fatality rate, the equine racing fatality rate. I just used December 10th of 2023 because that's today. Today is December 10th, 2024, to compare it to last year. And as of today, we're at 0.88 up till now in this point of the year. So we only have a few weeks left, so hopefully we will end up somewhere close to 0.88 by the end of the year. That's about a 25 to 30% reduction. And that's because, not just HISA, it's because the entire industry has been working together to prioritize equine safety and to prioritize the principles that we really want horse racing to be judged by. This is just a little bit of a graph of the quarter by quarter, but what I want to talk about for a minute now is how did we get here and what are the things that we can take advantage of in the future that will enable us to continue on this progression. So really there are three pillars. The first is what we call our veterinary protocols, and that is making sure that we have everything in place, everything in place to have all of our pre-race exams, make sure that we're able to observe, or that the vets are able to observe the horses post-race, all of the things that we use to basically oversee the health and safety of horses. The second are our services, which Lou talked a little bit about, but it's incredibly important that we make sure there are safe services. That's an important component. And the last one is our anti-doping program, which is there to ensure that nothing is in a horse's system that shouldn't be there. Now, just speaking more specifically about veterinary protocols, Dr. Jennifer Durenberger, who's our Director of Equine Safety and Welfare, does an incredible job working collaboratively with the industry and with all of the veterinarians in the industry to work towards our common goal of protecting the horses. That means, more hands and eyes on horses both before and after. Not every racetrack had pre-race exams before HISA was implemented. We track injuries and fatalities in real time. Now, what's really been a game changer for me is that Steve Keach, who I mentioned earlier, has built a portal and a dashboard for those of us who work internally at HISA that we can look every single day to see what the national numbers are with respect to equine fatalities and equine injuries and how they break down. Are they musculoskeletal? Are they exercise-associated sudden death? Are they, unrelated like a colic? And we can react immediately when we see those numbers. We're not looking at them at the end of the year. We're looking at them on a daily basis. And because of that, there have been some situations this past year where we've had to, deploy people to various racetracks to look at their processes, to look at their veterinary protocols, their services, to make sure that there's nothing there that we can help fix because we were starting to see fatalities and starting to see a pattern. So that's been a real game changer. Acting like one industry. You've probably seen that HISA has, over the last couple of years, started to build different interest groups to help advise it on how we should look at rulemaking, how we should look at oversight and regulation. And those have been really, really impactful, and we've really listened to them, and we've made changes, and we've made improvements. This is, HISA, I look at it as it belongs to all of us, and we need to work together to make it the best version that it can be, which is obviously what Lou had also said. One example that I think has been truly helpful is that because of HISA, we can now help races like the Breeders' Cup or the Triple Crown by collecting all of the veterinary records for the horses that are competing at those races and supply them to the veterinary team in advance so that they're able to work effectively and efficiently and don't have to go to 25 different racing jurisdictions to ask for records. We've put a pretty significant emphasis on necropsies, making sure that we're working with the laboratories that analyze them to enhance the information that we're getting for our researchers and our veterinarians to make sure that we can learn whatever we can from those examinations in order to ultimately, obviously, do better in the future. And since we now have, as I said, 4 million veterinary records and we're sort of further down the road, we can start to be a lot more intentional about matching the data to the regulations. Making sure that we have regulations, they're supported by the data and they make sense, that they're achieving the goal that we want, which is keeping horses and our riders safe. So 2.0, and this is what the future is going to look like, changes you can expect to see going forward. One is enhanced transparency. Most of you should probably know that we started this year actually reporting on racing fatalities by quarter, both by state and by track. So previously, because the Equine Injury Database did a fantastic job for a number of years, but it was on a voluntary basis, so all these numbers weren't available to the public. Now they are on a quarterly basis, and then we're going to start providing that same data for training fatalities in 2025. So in the first quarter of 25, we'll give you the training fatalities from all of 24. Then we'll start to follow the pattern that we've had with racing fatalities, which is reporting them on a quarterly basis. And we're going to also start to look at, we get a lot of questions about scratches. Are scratches much higher under HISA? They're actually not. They're only marginally higher under HISA, but we're going to start looking a lot more at that data and giving that back to the industry in order to help essentially evolve. Okay, moving on to the next thing. Supporting new research, working with our industry partners. We announced earlier this year that we were going to fund some startup research on exercise-associated sudden death. We're going to work with the Grayson Foundation long-term to keep that research going. But EASD represents 16% of equine fatalities, and it's a black box. No one globally or within the US really understands what causes them, and so by researching and getting information about what some of those risk factors might be, we think has a really, significant opportunity to be meaningful and to help us going forward. More necropsy workshops to help the laboratories understand what we need to essentially use those effectively. Dr. Durenberger is going to be announcing a new veterinary committee that's going to be a committee of veterinarians, regulatory association veterinarians that will help her as we sort of move through this next iteration of HISA and try to examine all of our regulations to make sure that they are data supported. And then we are mandated by our Congress and the Act to essentially engage in various research around furosemide. We have 3 studies that have already been funded. We're looking to fund some more studies. We have until 2026 to report back to the HISA board, and that's obviously a very important research component. Now, probably the biggest, game changer, and this is true across every industry, is in the era in which we live, is leveraging technology. And there are a lot of different groups and actors within our industry who do a fantastic job with technology, and we are really happy to work alongside them and with them. Some of the ways that we've been able to do that is we use our technology to primarily empower the regulatory vets and the officials within horse racing to make quicker decisions, better decisions, and to be able to explain their decisions more effectively to our stakeholders. And so a little bit about why we asked for the data. We obviously we want to keep horses safe and leverage our technology. We started working with a company called Palantir, and actually we have somebody from Palantir who's going to be on a panel later today, but using their technology tools to develop essentially a risk model that looks at a number of different potential risk factors for horses and assigns to every horse on every race card every day under HISA's jurisdiction a numerical risk assessment. And we provide that information to our regulatory vets on the ground to help them with their pre-race inspections and to help them as they get closer to race day. And the reason is that especially in smaller jurisdictions, we have regulatory vets who are required to examine a huge number of horses over a relatively short period of time. We want to give them tools to be able to do that better and also quicker. So HISA Check 1 is what we already are using, and I'm going to talk a little bit more about that in the future slide, and then get into what we see the future models, what the future might look like. So, I asked my IT department to explain to me how this all works, and this is what they gave me. So I'm just going to skip that because that is like Greek to me. Okay, so this is how we talk about HISA Check. And I used the different phones to sort of try to illustrate or be a metaphor for different iterations, right? So where we are now and what we've just completed and we've been using for a number of months with the regulatory vets is the system where we have 46 risk factors that give us thousands of trillions of combinations. It's based on the California post-entry screening model. And we use basic classifications of horses being at risk or not risk. And again, we provide this information, it's done every single day to the regulatory vets, and they can use it as a tool with hands-on horses and everything else they do to help them navigate their pre-race inspections. What we're working on now, and we're close to launching, is the second iteration, which is using 2,000 variables, giving trillions and trillions of combinations, which is more math-centric, and gives us a more sophisticated report or a more sophisticated analysis of the risk that can be used more substantively and more effectively. And then in the future, we plan to go to something that is even more mathematical and uses words that are beyond me, like clustering approach. But we expect that to really get us to a point where here, for example, with the model we have now, it's pretty good at identifying horses at risk, and it has a low false negatives, not as low as we'd like it to be. The second model has even a lower, has lower false positives and also lower false negatives and some targeted features, and we expect that number 3 is going to be even better. And some of the the mindset that we use, or that our team uses when they develop these tools, is making sure that we use all of the data that we're fortunate enough to collect. You know, everything that we get from any of you who put data in the portal, it is valuable. You are making a difference. You are changing what the future of horse racing really looks like from a safety standpoint, and we use all of that. And we try to make it user-friendly and deliver it in a way that is really easy for reg vets and stakeholders to understand and to utilize quickly. So this is, I'm going to play a short video of a tool that we recently started using that we hope to make available to regulatory vets relatively soon. And I'm really proud of our team for developing this.
Hi, welcome to Buttercup, HISA's new AI tool. We're going to pick a racetrack and a date. To get started, we'll see a race card, and we'll pick a horse. Here's Ripken. We're going to ask Buttercup about Ripken. First of all, we see a summary up here. Down here, we see timeline of all of Ripken's events. If you're a fan of HISA Horse Insight and you'd like to see Ripken's horse profile, you could click right here. The best part of all, though, is Buttercup. You can ask Buttercup questions. She'll give you the answers. So, Buttercup, when was Ripken's last IA? And she gave us the date. Okay, Buttercup, what is his longest layoff between races? About 8 months. What's his longest layoff if you include workouts and races? About 7 months, and she gives the dates. Thanks, Buttercup, you've been real helpful.
So the vision with Buttercup is that, you know, we can have regulatory vets in the field with their phones who can just essentially speak questions into their mobile device and get an immediate response in order to, again, make their lives easier. They have incredibly, I mean, my job isn't even anywhere near as hard as their jobs. They have incredibly hard jobs. They work extremely long hours, and we want to be able to give them the tools to, again, be more effective and also make their lives easier. Okay, so moving now on to safe services, that's the second pillar that I spoke about. Ann McGovern is our Director of Racetrack Safety, and she does a terrific job overseeing, with Greg Stiles, who's also here today, our racetrack accreditation process. We have, I believe, a really effective and cooperative approach to racetrack accreditations. Every accreditation involves a representative from the areas of human safety, equine safety, security, track surface, and administration, and they work collaboratively alongside the racetrack staff to try to make sure that essentially they are where they should be, and if they need some support, they need to develop something, that we're able to support them through that process. We work with a racing services testing laboratory to essentially test every racetrack before it opens to get measurements around essentially the various important metrics that we measure daily, actually, from the racetrack, so we can compare and contrast as the season progresses. And certainly if there's a problem, we can go back to those original measurements. And we're now getting measurements daily from the RSTL. We have a track superintendent advisory group that we're very fortunate to have. If there's a problem, we dispatch someone from that group that's made up of some of the best superintendents in the country, and we ask them to go to a track that's not theirs and take a look and help us understand if there's a problem that we could help solve. Again, this is all in real time, which has been, I think, a big advancement. And we also work with the Racing Operations Committee, which is essentially a group of racing executives to make sure that we're aligned and working together towards our goals. And then I also want to mention about the services in terms of what's coming for the future. There is new technology. There is an integrated racetrack surface tester that is going to be launched soon that's going to help us collect metrics that are potentially more relevant and easier for us to integrate and analyze. And we also are looking at some actual research around surfaces to understand whether or not we can learn anything from some of the developments in modern technology that other sports have implemented. And then just moving on to the anti-doping program, that's the last pillar, making sure that there's nothing in a horse's system that shouldn't be there. I want to tell just a 30-second story, which is last week I was in a meeting with a jockey who comes from a family of jockeys. Her father was a jockey. She has siblings and a lot of family members, and that's really been her life. And one of the things that she shared with me is that when her father was racing, he felt like he couldn't tell how a horse was, if there was something wrong with the horse, if something was off about the horse, because of some of the pain relief medications that were used. And she said that she feels so fortunate to be riding today because she can feel when a horse is off, because as an industry we've addressed that issue. And I think, everyone thinks about anti-doping as being about cheating and performance enhancement, and it is about that. We obviously need to address that, and we work on that daily. But it's also about keeping horses safe. If you're masking injury, no one, the horse and nor the rider, can feel if they're making something worse and if they're going to actually really harm themselves. And that's a very important really issue for us to manage together in order if we really want to be able to continue to protect horses. So just some numbers from the anti-doping program. 121,000 sample collections at 64 racetracks and training centers in 20 states. We have over 1,000 certified individuals who can do sample collection under HIWU. We've had 174 training sessions and supported visits. When a racetrack needs help, wants support, we always send somebody out there. And Kate Middlestat from HIWU will be talking about that on her panel, I think tomorrow. We've found there have been 54 substances that have been detected by program laboratories. And one of the things I want to just take a second here on laboratories, which is that because we now have one of the biggest, I think, differences in the anti-doping program that we can run nationally versus what the states could run on an individual basis was that the state laboratories were operating in silos. They weren't collaborating just by nature of the fact that these were all different contracts. In the attempt to, and the ongoing work towards harmonizing laboratories, the laboratories have to work together. They've got to share information. They've got to show their work. They've got to collaborate. In those situations, laboratories that aren't performing, they can't hide anymore. We've been able to, I think, really make significant advancements on ensuring that the stakeholders, the horsemen, get what they deserve, which is laboratories that are performing properly to the highest level and that are fair. And so I'm proud of the advances that have been made in that regard. Barn searches, 767, there have been a lot of tips that have come into the tip hotline. That's been a very, I think, helpful tool for HIWU. And I often talk about the atypical findings policy, which is our contamination program that doesn't get a whole lot of attention because it's not public. If actually a horse tests positive for an atypical substance, it goes through a private proceeding, because if it is in fact contamination, we don't want the public to be aware, since it was something that the horseman couldn't control. So that's been very successful. And right now, from the start of HIWU launching, we're at 78.4 days from the date of sample collection to the resolution of the violation. That's better than it used to be under most state systems, but we still want to work to improve that number. But it's just a little bit over 2 months right now. So what do we want to see in the future from the anti-doping program? Continued interaction and really continued engagement with our advisory groups. The advisory group, especially the Horseman Advisory Group, has really been instrumental in helping us to understand what we're getting right and what we're getting wrong, and to act accordingly. We are fortunate that because we exist only for racing, we don't oversee gaming, we don't do anything else, we are here to serve the racing industry. We can listen and adjust on a regular basis so that we are really being, in our view at least, the best version of HISA. We have some new ADMC committee members coming in, like David Ngordo, who's a longtime horseman, that I think will bring a different perspective and help continue to analyze our rules, look at data, et cetera. One of the things that HIWU is going to start doing is instead of reporting results from instead of the labs reporting to HIWU and HIWU reporting to the veterinarians, there's going to be direct reporting from the labs to the regulatory veterinarians of results, so that we can actually speed up this process, so that we improve essentially the time between sample collection and when the results come back, which is important. We've been prioritizing vets list samples, but we're continuing to obviously work on our turnaround times. And then the HEAL accreditation is the new accreditation under HIWU for laboratories. We're gonna move from the RMTC accreditation to HEAL, which is going to be enhance a slightly more involved process that we think is gonna further help us to improve the services the laboratories provide. And then I just want to say a few words about jockey safety. Obviously, we all know that protecting a horse is the best way you can protect a jockey, but jockeys are other professional athletes, and they have a lot of unique circumstances, needs, issues that we at HISA believe are really important to address and have not been able to be addressed to the extent that we've been able to and will in the future, working alongside the Jockeys Guild as a partner. This year, we, for the first time, had a fly-in DC working with the Jockeys Guild, and we essentially educated a number of different legislators about how jockeys should be considered just like other professional athletes and be entitled to the same privileges, the same advantages, the same funding for programs as other professional athletes. And that was really successful. See us here with Leader McConnell, and then Representative Andy Barr with Johnny Velasquez and Mindy Coleman. And then a second thing that we've done, which is really important, is that we have a partnership with Sports Medicine Concepts, which is an entity that helps sporting organizations optimize their emergency procedures. So if there's an accident on the field, on track, everybody knows what to do in the moment and is really working as efficiently as possible. You know, one of the things that HISA mandates are certain types of ambulances, et cetera, which is obviously really important. But if the folks don't know what to do when an accident happens, you're not going to get the best outcome for the jockey. And so this has been a really good partnership. There are a number of tracks who are already doing a fantastic job, but those tracks needed some support. We were able to do that in preparation with them, do simulations, et cetera. We have a new partnership with OnRise, which is a leading athlete-specific mental health company, and this is the first time ever that that is available to jockeys mental health counseling at no cost at all. And it's not just mental health counseling. If they want to talk to a peer about how to write a resume, if they want to potentially leave horse racing and want to know what's next for them, or they need to talk about how to manage their finances, there are all types of different services available to jockeys through this OnRise program, up to therapy and psychiatrist. But this is already we don't know who's using it, it's confidential, but we know it's already being used. We launched it about a month ago, and just really believe this is going to be an important mechanism going forward. So in 2025, we're going to look to continue to work with the Guild and develop some of these programs around mental health, around the awareness of jockeys as professional athletes, around health and nutrition, and also around post-racing career planning. This is a photo at an international jockey health and wellness symposium we held at Keeneland this year in Lexington in October, which brought in experts from around the world to talk about concussions, mental health, nutrition, which was really a very successful conference. So I'm going to end now and really just sum up by saying the first couple years of HISA, we're building the foundation. It was, like triage, there was a lot to get done. We had to get things just up and running. But now we're at a point where we can take all of that work and everything that we've gotten from the industry and give back to the industry in terms of information and products and really bringing the industry to the next level. I want to echo a lot of what Lou said. I think horse racing is, the most amazing, incredible sport with such a storied tradition and history, and working together, we can continue to really highlight its best features. And the way that I look at HISA is that if we can be doing all this in the background, all of the the tracks like Oaklawn can really be at the forefront and shine. And we will just be there in the background making sure that instead of seeing, a horse, having a musculoskeletal injury, crossing the line, you see this fantastic story of, the horse that won the Triple Crown. And so that's really, where we're going and what we want to do in the future. And I just want to say once again that I'm very grateful to the industry. Of course, we know that not everyone loves HISA. There's lots of different views, but for the most part, everyone has been working collaboratively together to do the best that we can in the moment. So thank you all, and I look forward to speaking with many of you during the course of the next couple of days.